version and the faculty version, so bear with me on that. But you're getting an idea of of how to talk to someone who might be suicidal. In addition, at the end, I'm going to give you a brochure with some names and numbers on there. So enjoy your food, listen, please interact and contribute to this discussion. It's a very important discussion for us to have. And the 11 o'clock hour, they made some great comments. So please feel free to share your experience as we go through this. So QPR stands for question, persuade, and refer. I generally start the presentation by showing them a short video clip of a young woman just coming to college who has a sad story. Initially, though, she starts out at one of the Ivy League schools. She's a student athlete. She's a bit of a perfectionist. She hasn't encountered many challenges, and then she has a history of mental illness and ultimately takes her life. We share a bit of the video just to kind of get the students in touch with our topic, but of course I don't show the entirety of it. But they can relate. As new freshmen coming to college, they can relate to the transition. And so we talk about that and normalize some of that transitional angst that we've all forgotten about, right? Because it's been so long since we've been college freshmen, but we talk about how that's okay. That's okay to feel a little uneasy at first. I go right into talking about some of the terms and explaining what a spectrum is, stigma, taboo, in our effort to insert some hope and positivity into somebody's life who's struggling. We talk about how personal health and wellness has a lot of different features to it: physical, social, emotional, intellectual, and how taking care of yourself has many facets to it. We talk about mental health being on a spectrum. We all have good and bad days. Doesn't mean we're necessarily suffering from mental illness, but we do have periods of time. And here's a stat for you that in anybody's life, there will be at some point where they might actually fit the criteria for a mental illness. So it's much more common than we like to talk about. And we talk about stigma and how, some people think, well, that's a weakness, or we don't want to talk about that. But so we challenge that. In the classroom, we challenge that and we say, hey, we are blowing the stigma out right now, right? Because we're talking about it. And we're talking about how it's okay. We all go through it, and sometimes we need to reach out. But back to the subject of suicidality. We talk about how in culture we tend to see all the high-profile stories. And individuals, of course, we can think of a couple recently who took their lives and how all that's sensationalized and presented. But that's not necessarily accurate of everyone. Here's some data from 2012 that just shows the degree that people who have suicidal thinking or made suicidal attempts or completions, show some numbers there. A lot more attempts, a lot more people in crisis than actually complete suicide. But still, it's indicative of just how many people struggle with it, right? And this is what got reported. Imagine how much of it goes unreported. So a couple of myths that we'll go ahead and dispel right off the bat are that suicide can't be stopped. It can, of course, be stopped. And here's the big one, that you should address it openly with the person. Sometimes we're reluctant to bring it up because we think we'll plant the idea in their mind. If they haven't thought about it and I bring it up, then they may go off and do it. And actually, the research shows that's not the case, that instead you may allow that person to open up and express some needs that they have. And so you're opening the lines of communication. You ask them, are you thinking of suicide? Are you thinking of hurting yourself? So that's the one thing that I like for them to walk away knowing. It's okay to ask a question and ask it directly. Preventing suicide is everybody's job. Another myth that we dispel is that suicidal people keep their plans to themselves. And the truth is that most of them communicate their intent sometime during the week preceding. So there are clues, there are things that we will pick up on, and we'll talk about specifically in our environment at university, what kind of clues to look for students in distress, period. So sometimes I would get a little pushback from students like, well, how do you know? Sometimes people will just talk about it and maybe they're just frustrated. And the truth is we what? You don't know. You don't know until you ask the person, hey, are you feeling, are you just so upset over this that you think you might want to go kill yourself? So we take all signs seriously, and we don't know until we ask. We can't just assume that they're just complaining to us or joking around. That's another one. Sometimes we say things in jest. We'll say, we don't mean it. So what do you do with that? You pay attention and you look for additional signs and clues that the person is in distress. I talk to them about risk factors and protective factors, and the risk factors are these: mental and behavioral health issues, of course, hopelessness, stressful life circumstances, a family history of mental health or suicide, put them at risk. Stigma is another one. So thinking, I don't want to bother anybody. I don't want to talk about this. And when I think of this, I think about our students who come from different cultures and how it's okay in certain cultures to willingly have to help with struggle in other cultures. And then we could also talk about individual family units, what's acceptable or not. But stigma, while we think, okay, we've got all these services out here for students, they should just go and partake, we have to remember that not everybody sees that the same way. All right. Let me mention specifically that it's one consideration here is that for some students, stress will be presented as somatic complaints, such as chronic headaches or stomach aches. So they may end up at the health center. The health center then funnels them back to the counseling center. But that's okay to say. It's okay to say I'm not feeling well, but it's less acceptable maybe for them to admit that they have mounting stress and they don't know how to handle it. Protective factors, mental and emotional well-being, positive beliefs, social support, safe, and physical activity. So I will challenge the students, as I'll challenge you, look at that list and see what kind of protective factors you have in your life and how you could perhaps add to those. And then I talk to them specifically about being engaged on campus and also getting enough, trying to sleep, trying to take care of themselves. Let's look at some clues. And these are direct verbal clues that you might hear from a student or coworker. And I'll let you read this list. And imagine if someone were saying these things to you. Anyone find this to be a little upsetting, a little challenging, a lump in your throat, a little tension? So yes, if you heard things such as I decided to kill myself or I wish I were dead, that immediately is a red flag and would make any of us anxious. my point in that is understand, okay, this is a time to act. This is a time to refer. And we'll talk about that. We'll talk about what to do if these situations occur. But the first thing you'll have to do is probably take a good hard swallow and say, okay, this is serious. And let me just normalize that for you. Indirect verbal clues are just as important to pay attention to. They just may be worded a little more mildly, like, who cares if I'm dead anyway? Or, I just want this to end. I just can't go on. And again, this is sometimes where I get pushback from the students who are like, well, you know, I'm through this, I don't pass this test, I'm just gonna die. And my friends say that. And so again, the challenge of, yes, we do, we say these things, but as your friend gets things over and over. Other clues that this person is struggling, and so you're kind of putting it together that they need some support. Behavioral clues include previous suicide attempts, acquiring a weapon, medication, co-occurring moodiness or depression, putting their affairs in order, which I always have to explain to the students, giving away possessions, sudden interest or disinterest in religion. Sometimes the student may all of a sudden just be fine. Why is that?
Decided to have a solution.
Yeah, they have an answer. They know when it's going to end. And so that can be a warning sign as well. Drug or alcohol abuse, as well as relapse, and of course, any kind of mood issue along with substance use is a pretty serious combination and may increase an impulsive act. So that's a very serious combination. And then unexplained anger, aggression, and irritability, maybe verbally lashing out. We'll come back to this a little bit. Here's some situational clues. Read through this list and see if there's something that you identify as a theme.
There's an unknown aspect to it. What's next?
Yes, an unknown aspect of what's next. Yes. Especially after what? Loss. Yeah. So some of these might be major losses, such as losing a family member or a relationship. Some of them might just be stacked up losses. Failed the test, I'm going to fail the course, I've lost my girlfriend, can't make my car payment, just because we're talking about students who may not have how shall I say this delicately? They are young. The frontal lobe is not completely developed there, so the decision-making skills are perhaps not intact, as well as the fact that they may not have coping strategies. So they may be more prone to acting impulsively. So while we would look at these losses and we would definitely stop and reassess, for them it might be, well, this is that I don't have any options. So they may act rashly or be thinking that they have no options. And that's really what suicide is, right? It is the perceived, or there's a perceived lack of options. All right, so let's step back just a little bit from suicidal thinking and just talk about students in distress. Some academic signs of students in distress are these: the not turning in work or poor quality of work, absences, tardiness, disorganization, erratic performance, sleeping in class, or disturbing writing content. Have you seen any of these before? I got one nod.
I think the one that I see the most is absence.
Okay. Yeah.
So like long bouts of absence, so missing 4 or 5 course meetings in a row and then showing up later. It's just historically been a sign that, you know, every student I've seen do that has had to do some sort of mitigation to get themselves back into good mental health.
Okay.
So it's pretty
Right. So they've hit a wall.
clear, yeah.
Whatever it is, they've hit the wall. They can't cope, and so obviously sitting through class or whatever is an indication for you. So what do we do? What do we do?
Ask.
We ask, yes, if we do see, back to the suicidal thinking, that, if they are presenting with that issue, we definitely ask. And I actually just need to check in, right?
Mhm.
What's going on here? Touching base with them. I had a student this week, not herself. Usually she's pretty put together, but she was not. And yeah, that's exactly what I did. Went up to her and said, "Are you okay?" And then she had a reason, moved through it, moved on. But these are definitely indications that students need to be checked on. What else?
That last one there is, I think, a biggie for writing.
Yeah.
Yeah, I've taught some courses where we do a lot of heavy journaling.
Mhm.
And a lot of that journaling is just an opportunity for them to reflect on content and so forth. But they will go into some pretty specific, deep thoughts sometimes. And that's why it's so critical that you read every word
Mhm.
of those journals, because they could be reaching out to you with content. If you haven't read it, just put a check mark, take a photo of the assignment. The missed opportunity could lead to some other things. So that writing is pretty
Yeah.
essential.
Yeah. I added that one myself
Mhm.
because we discussed some of these at the counseling center, but that's one that I've seen too.
Mhm.
And it's exactly what you say it is. It's an indication that there's maybe they've not thought about it. Maybe they're reflecting. It's a reflection paper, but it's something maybe a plea for help. It may have just been a bad day,
Mhm.
but you won't know unless you ask, and unless you're reading. They write. What else?
I'm working with one student who all of the professors understand the student's not doing well, but the student is, I'm fine. I just scheduled some tutoring sessions just in case. Oh, you're failing your thoughts.
Okay.
Yeah.
So potentially more going on than academics. All right. Physical signs of student distress, being lethargic or appearing anxious, lack of personal hygiene, appearance, dramatic weight loss. These are signs that are worthy of paying attention to, and also an indication that they may need your help. Emotional signs of student distress include these: outbursts or extreme behavior, isolating themselves, withdrawing, and not showing up to activities, labs, etc. Sudden mood changes, hopelessness, and fearfulness. And so back to the age of our students, it's worth noting here that the late adolescence, early adult time of life is a time when the onset of mental illness may occur. So mood disorders may appear during this age. substance use, as well as anxiety disorders. So the development of a disorder at this time of life is possible. Obviously, it may not be, but these are some signs to watch for. Anybody else? I know we have a lot of experience in here, so please feel free to chime in.
One thing I was going to say when I see this list, I think a lot of students who, I think of hopelessness and fearfulness of students who kind of have this one track mind of this is where I want to be and I'll do anything to get there. Because being in science, we teach a lot of people who aspire to be doctors, and that's not a career that's meant for everybody for a variety of reasons. But some people just feel like if they can't achieve that, there's no other way they can be successful. And so one of the things I always try to do, unfortunately I teach a class that teaches a lot of freshmen, is if they come to me and they're already having this hopelessness and fearfulness, I ask, well, what are some other plan Bs just in case? Because that goes back to if they get to the point where there's no return, like they've gotten so far into it and now they don't see that it's going to come to fruition. That's when I feel like I see a lot of the other signs of there's nothing else I can do about this.
All or nothing.
Yeah.
All or nothing. Yes. Okay. All right. So you go ahead and plant the seed. You have other options. Yeah. Okay. Someone in the 11 o'clock hour mentioned some self-care tips that I guess the education department gives to students. So, addressing that is certainly something that could be simply done, such as it's going to be a demanding course, or this is going to require so much. And so what are you going to do? What are you going to do to create some balance in your life? And let me encourage you to do that. May make them think of it and when they've never not thought of it before. So for QPR, the question is to straightforwardly ask them if they're thinking of committing suicide. If the person is reluctant, you're to be persistent and to ask them privately. Obviously, you're going to pull them aside with this kind of question. Doesn't matter so much how you ask it, is that you ask the student. Some people are less direct. My style is to be direct because I want to know. I want the answer. I think I can couch it in such a way that they won't, that they'll feel safe enough to tell me. If you don't feel that you can ask the question or the timing's not right, get them to someone who will, or someone who can. So please avoid this. You're not suicidal, are you? We're being recorded, right? So I've got to not assume everybody. All right, so the students are quick to pick up on the fact that this implies judgment. Yeah. You're not one of those, are you? Okay. So show some acceptance. My guess is we can all relate to those times when we felt a little without hope, but yet we are in a position to interrupt their plan there that they might have. So the P is for persuade. You want to listen and give them your full attention. Suicide is not the problem. It's only the solution to a perceived insoluble problem. Yes, they have options. And they really don't want you to fix their problem for them anyway. None of us do. We just want you to watch. Yeah, just maybe listen. Just listen. And then you're going to decide. And I do have a slide coming up about when to refer. But this one says, the next one is some dialogue here on, will you go with me to get help? Will you let me help you get help? And at this point, if the student is in distress, you will want to personally walk them to the counseling center for their own safety. Do you know where the counseling center is? because I make sure the students do. It's moved. You know, did you know it moved? Yes, well,
Mm-mm.
it is on the second floor of the SAC. Yeah. So all on paying, go in on the elevator up to the second floor, and there you would tell whoever's at the desk that the student's in crisis, they need to see someone. Someone asks what happens then. They may have to wait a few minutes, but they would not be left alone, and someone, a counselor, would come out and they would do an assessment with the student and decide where to go from there. They may develop a safety plan, or they may call mental health co-op, and they do their own assessment, and then the student would be gotten some further resources off campus. So a lot of things could happen depending on the student's, what the student needs. But if you are with a student in crisis, walk them over and deliver them to the students, to the counseling center, who will respond to them. Questions about that? Anybody had a similar experience or want to tell us what? Yes, you've had that experience?
I've done this.
Yeah.
Had to end up twice having to call mobile crisis, and then second time 911 to restrain a student or remove them.
Also, that just reminds me that also we have another option. Well, first of all, maybe the student is not in crisis, but you want them to refer them for services. So they could get online. You get online with them and say, hey, go ahead and set up your appointment. And follow up with them and say, hey, I'm so sorry that this has happened to you. Let me encourage you to go get such and such help, and then I want to follow up with you on that and see how it's going. Have you done that? Anybody in here? Thought you like my class? Just yes, no. You can shake your head. So, good. So we persuade them, and then we refer them, taking them directly to get the help they need, getting a commitment from them that they will themselves seek the help, because perhaps they're not in intense crisis mode, but they need some support. We do have some wonderful supportive people here. We really do. So another thing about referring is that you want to avoid a power struggle with the student. And of course, any kind of judgment about that, but instead present yourself as a collaborator, as an ally. So sorry you're going through this. Let's see how we can, support you. Let's see what we can do to get you through this. So avoid, maybe negating anything that they're feeling or expressing to you. Oh, it's really that bad. You would never, want to do that because of it's unhelpful, and it's not going to convince them to step out of their comfort zone to get some support. So create an alliance, sort of a collaborative process. The other thing that I want to mention, this is a slide on determining level of urgency, is that remember that we have the BIT team here at Lipscomb, the Behavioral Intervention Team, and you can get online and put in a file report with the BIT team. I'm pausing to let that. The Behavioral Intervention Team is made up of a variety of people on campus, including Kathy Marcus's office, student life, security, and I know a couple of people last hour brought up students who were off campus or students who were commuters. I'm going to give you a brochure. This would be really helpful if your students are living on campus. What if they're not? Or what if they have a spouse or someone that they're pretty, or even a returning student that not enrolled, found out. So the behavioral intervention team takes a look at these case by case, and whoever can address it, who needs to address it, will. So that's definitely something that access is needed. You all aware of the behavioral intervention and perhaps used it? Okay, great. All right. So in determining level of urgency, are they willing to access support from others? If so, make them aware. Have they stated an intention to die or cause harm? Red flag. Have they reported a previous suicide attempt or self-injury? Another red flag. And then have they left you with an uneasy feeling with respect to their safety or the safety of others? And that surely is something that you don't want to carry around with you, right? That's a chance to, that's sort of an indication that others should be made known about this person. And maybe other professors are seeing similar behaviors, and so there's a cause for concern, and everybody can kind of be made aware. The important people need to be made aware that this student's in distress. Which students on our campus do you think are at risk? Categories. What? Veterans, yes. Yes, they are. The suicide rate for veterans is very high. And of course, Chad is over the center there. He does a good job supporting our veterans. The counseling center did have someone who worked specifically with veterans. I don't know if she's graduated. She was an intern. Who else might be at risk? Yes, the LGBTQ students are 4 times more likely to have suicidal thinking or to act on that. And so being attentive to that category of student. What were you going to say?
I was actually going to say that one, but
Say that?
another one that came to mind is, and I don't know if this is true, but maybe first generation college students. I don't know if there's a statistic on that, but
Yes, there are a lot of statistics on first generation. I think a lot of them have to do with attrition rates, but yes, we'll set right in have that one. So first generation college students, yeah. Talk about reluctant to reach out for support sometimes. That group can be. So making them aware. Somebody mentioned graduate students in the last hour because of the stress and strain of just juggling school and work and family. Again, preaching some self-care, encouraging some self-care. Yeah. Okay.
also think of, when I think of graduate students, also think of balance, because typically, not all the time, of course, but a lot of graduate students are in that field because there's some type of passion for that. Not always the case, but and so sometimes I've seen it become difficult. That line is blurred between when do I stop working? Because you could do a lot of work at home, so
Right.
and that's when I think I would see. I mean, even for me personally too, when I was a grad student, I had a lot of those emotional signs because I never stopped working.
Right. Yeah. You can get passionate about it and forget to sleep.
Yeah.
And while we think, oh, well, what's a little sleep loss? A little sleep loss can wear and tear on you. And it can definitely blur some coping strategies there, options. Great point. What else? What else can you contribute to this group of people here? Any of you? We have some seasoned people here. Anything else? Did I miss anything from 11 o'clock that you want to throw in?
I mentioned if they mentioned something in an email conversation
Yes.
and what to do if they mention it in the email and they're not on campus.
Right. So yes, if they email you, that's definitely troublesome. And as I told as I said, there have been times when teachers have forwarded emails in the bit report
Mhm.
and said, hey, I'm concerned about this student, want to make everyone aware. And that would be appropriate to do, for sure. Yes. Somebody else mentioned study abroad.
Mm.
That's another, how do you support those students? How do you support the faculty dealing with students who may be away from home? And I didn't mention our students, I should have mentioned in the high-risk group, our students who are adjusting to our culture, right? Acculturalization is a pretty difficult to do for those coming here. So we want to be mindful of them. But if you have students studying abroad or students who are online, taking online classes, that's another area where it's tricky for navigating support for them. That's all I have for you. So
Do you
I
have any
will.
perspectives, any additional perspectives on how this conversation translates to faculty and staff?
Mm.
So about how to help caregivers.
Mhm.
Well, I will say that the counseling center, while it is geared for students, it is also, well, it's geared for students, it is also available for faculty and staff. I know in the past when I've seen students, I've seen staff happy to reach out to anybody who just needs some support. And oh my goodness, life is just that way. Sometimes we just need to talk it out. Therapists need intervention. So I would encourage them to go over there. Yeah.
Are there signs, symptoms, and responses any different from the student responses?
I think obviously you're dealing with adults who perhaps have more resources. And so maybe encouraging them to reach out to ministers, good friends, maybe helping them identify who's in your corner, who can support you through this. Certainly you would be one who's, I'm here for you, I want to help you, but maybe just helping them think about their options. Maybe so again, we can get in such a state that we forget to reach out, and we forget that we can access other people around us who've gone through similar things. They're the best to sometimes to advise us or comfort us. With a lot of the things that we've talked about, it has in it a sort of a flow chart looking thing here for what to do if you have a student in crisis. But I will tell you that the counseling center is just about at capacity already. And when they reach capacity, then they refer to the family therapy center, which is the building by the Green Hills Church. Green Hills. I'll get it right, Heidi. And so, but they serve the community. So, but they will, of course, take our students as well. Any student in crisis will not be turned away, though. Yes.
And it's so painfully exciting for an on-campus undergraduate student.
Well,
it is, but if you thought about putting together a pamphlet more for a graduate student or a junior student.
that's a great tip. I'll be happy to pass that on. Sure will. And again, my time, so I was on the bid team last year, and several of the reports that came in. By the way, you can rank those reports as being urgent or not urgent, and then that will help everybody involved try to assess it. But that's definitely a resource for a student that you might be worried about. Good point. What else? That's all I have for you. So turn it back over to you.
All right.
Okay.
All right. All right. Thank you guys so much for coming